Welcome to another episode from the Veterinary Research Channel. Today, David and I are diving into some fascinating research that sheds light on a common issue we see in our canine companions, gastroesophageal reflux.
That's right, Emma. It's something many dog owners are familiar with, especially when we talk about certain breeds. We often hear about brachycephalic dogs, those with the shorter faces, and their tendency to experience reflux and even regurgitation.
Exactly. Conditions like these can significantly impact a dog's quality of life and may even require medical or surgical intervention. So, understanding what's normal versus what's excessive is really crucial for us as veterinary professionals and for dog owners alike.
And that's where the research we're discussing today comes in. This study, conducted at the Animal Hospital at Murdoch University in Australia, aimed to establish some baseline understanding of gastroesophageal reflux in healthy, non-brachycephalic dogs.
It's an important distinction, David. While we know a fair bit about reflux in those short-nosed breeds, we haven't had as much objective data on what to expect in other dogs, particularly in a hospital setting. The researchers pointed out that previous studies were often conducted under experimental conditions with smaller groups of dogs, sometimes focusing on specific breeds, sizes, or sexes.
Right. And some of those earlier studies even used more invasive techniques to monitor esophageal pH, which might not be ideal for routine clinical use. Plus, many of them only looked at the lower part of the esophagus, not considering how far up the reflux might travel.
So, this new study set out to address these gaps by using a minimally invasive method called esophageal pH monitoring in a group of healthy, non-brachycephalic dogs undergoing routine orthopedic surgery. They wanted to establish what constitutes a normal amount of acidic gastroesophageal reflux in these dogs after a short period of general anesthesia.
And their approach was quite interesting. They used a special probe with two sensors that could detect the pH levels in both the lower and upper parts of the esophagus. This allowed them to monitor how often and for how long the esophagus was exposed to stomach acid, which is defined as a pH of less than 4.0.
After the dogs had their orthopedic procedures under a short total intravenous anesthesia, the researchers kept the pH monitoring probes in place while the dogs recovered and were hospitalized overnight. Importantly, the dogs were unsedated during this monitoring period, which gave a more realistic picture of their normal physiology.
They carefully defined what they considered a gastroesophageal reflux event as any instance where the esophageal pH dropped below 4.0. They then looked at two main parameters. First, the number of these reflux events per hour, and second, the cumulative amount of time, expressed as a percentage of the total recording period, that the esophageal pH was below this acidic threshold.
Let's move on to what the researchers actually found. They included 35 dogs in their study, representing a good range of ages, breeds, and sizes, from Labradors and Golden Retrievers to smaller breeds like Schnauzers and Maltese. The median age was 7 years, and the median weight was 30 kilograms.
It's interesting to note that none of the dogs showed any signs of regurgitation, that is, actively bringing food back up during the monitoring period. This highlights that gastroesophageal reflux can occur even without overt signs like vomiting or regurgitation.
That's a really important point. The study found that gastroesophageal reflux, specifically in the lower part of the esophagus, was quite common, occurring in 28 out of the 35 dogs. However, the frequency of these events was generally low. The median number of reflux events in the lower esophagus was just 0.3 per hour.
And when they looked at the upper part of the esophagus, reflux was even less frequent, only being recorded in 12 of the 31 dogs that had the dual sensor in place. The median number of reflux events in the upper esophagus was 0 per hour.
The researchers also measured how long these reflux events lasted. They found that the longest reflux event in the lower esophagus had a median duration of 3 minutes, while in the upper esophagus, it was just 1 minute.
And perhaps one of the most clinically relevant findings was the cumulative esophageal acid exposure. In the lower esophagus, the median exposure was only 0.2% of the recording time, while in the upper esophagus, it was 0%.
Based on this data, the researchers were able to establish upper reference limits for these parameters in this population of healthy, non-brachycephalic dogs. For the lower esophagus, the upper limit for the number of reflux events per hour was 2.4, and for cumulative acid exposure, it was 2.3%.
And for the upper esophagus, the upper reference limits were even lower, 0.4 reflux events per hour and 0% for cumulative acid exposure. These upper limits are really valuable because they give us a benchmark against which we can compare dogs that we suspect might have excessive gastroesophageal reflux.
Absolutely. If a non-brachycephalic dog undergoing similar circumstances shows parameters above these limits, it would suggest that they are experiencing an abnormal amount of acid reflux.
Now, let's delve into the discussion of these findings. The researchers concluded that occasional, brief episodes of gastroesophageal reflux are actually a normal occurrence in hospitalized, non-brachycephalic dogs without any known gastrointestinal issues. This means that some degree of exposure of the esophagus to stomach acid is to be expected in this setting.
They also highlighted how their findings build upon previous research that suggested infrequent, small amounts of reflux might be normal in healthy, non-anesthetized dogs under experimental conditions. This study extends that understanding to dogs in a more typical clinical environment.
It's interesting to compare these results with what we know about brachycephalic dogs. The researchers referenced a previous study they conducted on those breeds, which found significantly higher rates of both distal and proximal reflux compared to the non-brachycephalic dogs in this study.
Yes, in that study on brachycephalic dogs, the median number of proximal reflux events per hour was much higher, at 1.9, and the median longest proximal reflux event was also considerably longer, at 9 minutes. This stark contrast might help explain why we see more frequent regurgitation and even aspiration pneumonia, lung inflammation caused by inhaling foreign material, in those short-faced breeds.
Applying the upper reference limits established in this study to the brachycephalic cohort from their previous research revealed that the median reflux parameters in the brachycephalic dogs were well above these limits, further emphasizing that they experience a much greater burden of gastroesophageal reflux.
The study also touched upon the technique they used for placing the pH monitoring probe, which was transnasal, meaning it was inserted through the nostril. They noted that a previous study using a similar approach in conscious dogs reported some nasal irritation. However, in this study, where the dogs were under light anesthesia for the probe placement, the only adverse event was minor, intermittent sneezing in a few dogs upon recovery.
This transnasal technique seems to be a significant improvement over some older methods that involved more invasive surgical placement of the probes, which could lead to complications like esophageal perforation. The researchers rightly pointed out that while placing the probe in conscious dogs might avoid anesthesia risks, it would likely be poorly tolerated and stressful for the animals.
Of course, the study authors also acknowledged some limitations. One was the possibility that a few dogs with mild, undiagnosed gastrointestinal issues might have been included, despite their screening process relying on owner questionnaires and discussions about easily observable signs like vomiting and diarrhea. A more definitive exclusion would have required more extensive testing, which wasn't feasible for this study.
Another point they raised was the variability in the duration of fasting before anesthesia. While they estimated it to be between 12 and 18 hours, the exact duration for each dog wasn't known. They cited previous research suggesting that longer fasting periods might increase the frequency of gastroesophageal reflux, so this could have been a contributing factor.
They also considered the dogs' diets during the study, noting that they were fed either boiled chicken or commercial wet or dry food. While there's limited evidence in dogs about how different food compositions affect reflux, studies in humans suggest that factors like carbohydrate content can play a role. So, the consistency of the diet in this study was a good starting point, but further research could explore the impact of different dietary components.
Finally, they discussed the definition of a gastroesophageal reflux event as a drop in esophageal pH below 4.0. They noted that in human medicine, more sophisticated monitoring techniques that combine pH and impedance measurements allow for a more detailed categorization of reflux events, including weakly acidic or alkaline reflux. However, in veterinary medicine, most studies have used this pH cutoff of 4.0, consistent with strongly acidic reflux. Whether the more nuanced classification from human studies are relevant in dogs is still unknown.
Overall, this study provides valuable reference data for gastroesophageal reflux in healthy, non-brachycephalic dogs in a hospital setting following short anesthesia. The upper reference limits they established for the frequency and duration of acid exposure in both the lower and upper esophagus can now be used by veterinarians to objectively identify dogs with excessive reflux. This can aid in diagnosis, treatment monitoring, and ultimately in improving the care of our canine patients.
It's a great step forward in understanding this common issue in dogs beyond the brachycephalic breeds and provides a more evidence-based approach to identifying and managing gastroesophageal reflux.
Indeed. This research highlights the importance of objective measurements in veterinary medicine and contributes significantly to our understanding of normal gastrointestinal physiology in dogs. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.